All right, well, let me just go right into our presentation then. Today, our update will discuss the blueprint for a safer economy, which the governor introduced on the 28th, and go over the current status for Sonoma County. We'll talk a bit about our local COVID-19 data, an update on our skilled nursing and residential care facilities. We will talk again about some of the disparities and update in infection rates by race and ethnicity, focus on our cases, among agricultural and farm workers. And then we'll spend a little bit of time on schools and child care organizations and what we have seen so far in terms of COVID in these settings, since we are moving towards hearing some of the school waivers here this week. And then we'll talk about some balance measures or community health metrics. As everybody knows, as I discussed a few weeks ago, we are in a new framework put forth by the state called a Blueprint for a Safer Economy that consists of 4 tiers. All counties in California will fall into one of these 4 tiers based on 2 metrics. The one metric is a measure of our case rate, new cases per 100,000 population per day. And it will be reported over a 7-day average with a 7-day lag. The second metric, it has not changed from before. It's the testing percentage positivity. In other words, the percentage of tests that are positive over the overall numbers of tests that are performed. And that's also calculated in a 7-day average with a 7-day lag, as the state has data from the previous week. We have been consistently, since this framework started, in the purple tier, tier 1, in which we're still considered as having widespread coronavirus community disease transmission. This is because our new case per 100,000 per day rate has been above 7 cases per day. That would be 35 cases per day for the county, given that we have a close to 500,000 population. And our testing positivity, although has been in the 5 to 8% range, both of these metrics have to be in the next tier down in order for us to qualify for that tier. We also need to be in the next tier, that is the red tier, for a period of 2 weeks before we can fully transition in terms of the different recommendations for reopening of the county that are in the red tier. The red tier signifies substantial community disease transmission. The orange or mustard tier there, tier 3, moderate community disease transmission of COVID, and the yellow tier, minimal disease transmission. And based on which tier counties are in, the state has different recommendations for reopening that get more and more towards reopening as we go towards the lower tiers. So again, as I said, currently, as of today, Sonoma County's current status, which has just been updated by the state and will be updated every Tuesday for all counties in the state, puts us still in the purple tier with a 8.6 new COVID-19 positive cases per day per 100,000 population, which is significantly down from a month ago and even down from 2 weeks ago. So we have been shifting downwards. We started around 15 to 16 new COVID positive cases per day per 100,000. So that is a good trend. Because we're doing a lot of testing, that case rate gets adjusted a little further down to 8.3 new cases per 100,000 per day. Our positivity rate actually is 4.6%, putting us in a fairly good place there. So like the rest of the Bay Area and California, our numbers are trending down, which is what we'd expect, given that we're about 6 to 8 weeks after more restrictive measures were put in place, about 2 months after. And I just also wanted to point out that we are also at this point amending the health officer order to align completely with the state, meaning that as we move from one tier to another, we'll automatically take on the recommendations or the reopening suggested by the state based on the tier that we're in without further need to modify the health officer order in order to reopen or get more restrictive as the case may be. Again, this shows you the trend of new cases per 100,000 population. We were sort of peaking somewhere around mid-August, but recently you can see we've had a downward trend in cases, which then reflects in our metrics that we're looking at. So we still are in that purple tier, but I think we're getting closer to the red tier at this time. As far as our test positivity, again, that number sort of peaked, I would say, somewhere around mid-second to third week in August. And part of this is because we were actually doing a lot of testing as well. And now we are decreasing in the test positivity, and actually, as of this week, have made it into the orange tier. Even though our test positivity is in the orange tier, because our case rate metric is in the purple tier, we remain in the purple tier. Both have to align, and you can't skip tiers. So we'll have to go into the red tier before we can make it to the orange tier. Now I want to shift gears and talk some about the California Department of Public Health health equity measure that's being proposed. It will also be another metric that will factor into tier placement. And the goal is to reduce disparities in testing positivity between the most and least socioeconomically advantaged regions as ranked by the Healthy Places Index. In essence, to ensure culturally competent, linguistically congruent contact tracing and wraparound services for isolation and quarantine to be provided to the most vulnerable or at-risk communities. In our county, this would really target the Latinx community where we've seen these grave disparities. More will be released by the state on this measure soon. It has not been finalized at this time, but it is coming. Our testing volume has been good. Our average test per 100,000 population per day has been 233.8, well above the goal, which was 150. And that is what allows us to have an adjusted lower case rate because we're testing much above what we need to. You can see our testing has been in a fairly good range. Our laboratory capacity is good and has remained in this higher range now for some time. Hospitalizations, we had seen some increases again in August, but here in the beginning of September, and now we are seeing a decrease in hospitalizations, but our hospitalizations still remain above the state benchmark of no more than 20 hospitalized COVID patients per day, although that metric is not currently driving our tier status. And we've always been below the state criteria for the percentage of ICU beds that are available. We're now at 14.6%, and we want to be above 20%. However, again, this metric with the new framework, with the blueprint, has not been included for determining tier status. Looking now at our ever hospitalized COVID-19 patients, of which there have been 372, the majority, again, are occurring in adults over age 50, as you can see. It looks like the majority, like 73% or so, are occurring in that group over 50. Equally distributed by gender, 79% of discharge cases have recovered and 6% are still active. 27%, about 100, were ever in the ICU at any given time, and 53 of our hospitalized patients met with an ill fate and died. You look at the characteristics of the persons who died, total, and that would include outpatient and inpatient. Of the 115, 94 or 82% are associated with the skilled nursing facility and residential care facility outbreaks that we've had. So again, you can see here, sorry for the background noise there, but you can see that in total, 90% of the deaths, let me pause for a second so you can hear me. Okay, 90% of our deaths have occurred in those that are over age 65. But we have had close to 10% in the lower age group of 50 to 64 and 2% in the even younger age group of 18 to 49. And of the deaths, we have a fairly equal distribution of male and female gender specific data. And as we've seen all along, the majority of these people do have underlying conditions such as diabetes, cardiovascular disease, chronic lung disease, hypertension, or other underlying conditions. A full 1/3, however, had unknown underlying conditions. And this is what we've been seeing all along. It's the older and more frail people that have underlying medical conditions, and largely 82% associated with facilities, congregate settings that have made up our fatalities. So looking closer at skilled nursing facility and residential care outbreaks, overall, there have been 953 residents and staff who've become COVID-19 cases in Sonoma County in these congregate care facilities. 93 of the 562 residents infected then ended up dying, giving us a case fatality ratio of 16.5%. In other words, the percentage of those persons who died who are in the denominator, that's 562. The number of new cases, and this is a really good thing, has decreased dramatically in the past 2 weeks. So if you take a look then again at the total number of cases, we again see that the majority are happening in residents, about 2/3. And we have, again, 2/3 or so happening from the skilled nursing facilities or the post-acute facilities, about 1/3 happening in the assisted living or board and care non-patient care facilities. And so more residents and more in the skilled nursing facilities, as we'd expect, because that's where the more vulnerable and ill patients reside. Again, this just shows you a breakdown over time of cases amongst skilled nursing facility or board and care from staff and residents. The majority of cases, as you can see, are happening in residents, but we also have a good proportion, about 1/3 happening in staff. This peaked in the first week or two of August, and since that time we're seeing a decline and have seen even less cases in this group in the first week of September, and that is really good news. If you take a look by facility type over time, again, you can see the majority of cases happened there in sort of the beginning to mid-August. And more were happening initially in the skilled nursing facilities, but then the RCFEs or board and care homes began to catch up in the beginning to mid-August. And luckily, again, the numbers of cases occurring in these facilities, and this is the take-home point, have been decreasing. As you know, we got the state of California Healthcare Associated Infections Team and CDPH licensing, as well as Department of Social Service involved in early August or late July when we saw that we were having this big increase in cases. And I do think that the recommendations and interventions by the state have been really helpful, along with all of the county's actions in decreasing cases in these facilities. So what have we been doing in terms of the containment and prevention strategies? The healthcare acquired infections group at the state has a rapid response team that came out to help us with on-site visits. They've completed on-site visits at 7 skilled nursing facilities and 3 assisted living facilities in the county. During the site visit, they take a look at all operations as related to infection control practices, cohorting of patients, the wearing of PPE, the interactions and how employees or staff interact with the residents, and they make sure that cohorting, in other words, that people who are positive are put together and that those that are negative are put together, and those that are still pending test results or appropriately housed in this skilled nursing facility or assisted living facility. So they educate healthcare personnel on best practices for bedside care, infection control, and basically give recommendations for facility-wide measures to protect residents and staff. And they've visited some of these facilities more than once, had conference calls with them, debriefed with us. We've been on in the county level on conference calls, providing very close recommendations and following up to ensure that these facilities are able to implement the recommendations. There's also been 2 webinars for the long-term care community with current trends and up-to-date information for mitigating COVID. And I know that all of these facilities do participate on the weekly calls that are held by the state of California for the latest updates on recommendations for every aspect of COVID-19 management for the facilities. We have also given public health guidance to these facilities since March, when the outbreak or the pandemic started. In March, we issued an order to long-term care facilities requiring them to have COVID plans and infection control measures in place. This order also restricted visitation to limit the potential for COVID from entering into the facilities. In April, an order was issued requiring screening of staff entering into congregate care and living facilities, screening for both COVID-19 symptoms and temperature check, and also required all persons in these facilities to wear a mask or facial covering depending on the type of facility. In skilled nursing facilities, we required all persons to wear the equivalent of a surgical kind of a mask or barrier. And in the residential care facilities, we wanted people to try to get that level of face covering, but also allowed cloth or homemade face coverings. This order also discouraged staff from working at more than one facility, because we thought that if a staff member had COVID, that it would be really a risk if they worked from one facility to another before they were diagnosed. And this order required a change of clothes and shower between shifts for any staff working from one facility to another. And the order also prohibited communal dining and group activities at these congregate living centers. In August, we released a guidance on cohorting in skilled nursing facilities of patients. Again, as I was talking about, in the different zones. Red zone meaning the zone where COVID positive patients reside. The green zone, the area in the skilled nursing facility with negative patients, COVID negative or not exposed. And then the yellow zone being sort of that in-between zone where patients who are going to and from the hospital might be quarantined, where people who are pending test results might be held, where people who are contacts to COVID may stay while they're waiting for their test results and testing. So we gave some fairly clear guidance, as well as guidance for transfer to and from the inpatient or hospital setting. In September, we have had some feedback on social isolation and have really focused more on the mental health of residents in these facilities, and had conversations with the Department of Social Service, the ombudsperson, and others. And we lifted the prohibition on communal dining with very clear mitigation measures that would have to put into place by facilities for safety of residents during communal dining, including things like social or physical distancing, and limiting the numbers of people who could dine together, that kind of thing. And we are currently waiting or working on the restriction, a new guidance to loosen the restriction on visitation. That guidance also will be aligned with that from the state of California, and is really targeted at trying to mitigate some of the unintended consequences of isolation and shelter in place sort of requirements that is very clear are affecting the mental, physical, and social health of our elderly persons who live in these congregate settings. So more to come on the visitation guidance. Now, shifting gear, again, want to discuss occupational trends. Our epidemiologists have been putting all this data together for us, and we really want to have data-driven policy, so it's good to continue to track this. We are seeing elevated case numbers in agriculture, construction, healthcare, retirees, sales and service, the unemployed, and then an unknown category. But the fields that have the higher rates for contact rates are agriculture, healthcare, sales and service, probably due to the numbers of persons that work and in some instances also live together and are contacts in the household as well. If you look at cases by city, again, you can see that it's the greatest number of new cases has been observed in Santa Rosa. Over time, most other locations are seeing stable 14-day averages of new cases over time. And it's just important to follow this trend over time. Some of the numbers are driven by specific outbreaks, larger outbreaks in farm workers or agricultural workers that could drive some of these numbers. And we're tracking all of this over time and responding from public health with contact investigation, tracing, case investigation, and isolation and quarantine. We still have a disproportionate number of COVID-19 cases in the Latinx community. That's dropped, as I said last time too. We were at an all-time high of having about 70, I believe close to 77% of our cases occurring in the Latinx group. However, now that percentage has dropped to 54%. We have been really targeting this group with pop-up testing, with responding to outbreaks, with education, messaging through bilingual means, as well as Spanish radio stations and town halls, as well as the Facebook live stream, really trying to get the message out about the importance of all the mitigation measures, the facial covering, social and physical distancing, the importance of isolation if you're a case, of not going to work if you're not well, not feeling well, getting tested, and of quarantine if you're a contact. And I think all that has helped drive down the disparity. And now we're seeing a lower percentage. Still, there's about a good 6-fold increase in cases amongst the Latinx. Part of these numbers may also be that non-Latinx and non-Hispanic persons and the other race and ethnic categories are also out and about and doing things where they could be exposed. Because early on with shelter in place, most of those people were sheltering in place. And they weren't as making such a high proportion of the essential worker population. But now that more people are out and about, we are starting to see cases in those groups as well. And that may also explain some of the decrease in disparity that we're seeing in the percentages made up by these different groups. Still, as compared to non-Latinx cases, Latinx COVID-19 cases are younger. 86% are under 50 because again, they are really in that essential worker, and a lot of them are in the farm worker, agricultural area. They are also more often to be diagnosed due to close contact transmission, again, because of a lot of transmission of COVID in households. They're more often to be asymptomatic because they're younger, and we know that the younger age groups are more likely not to have symptoms, and their contacts. And we are testing all contacts in the household and workplace, those with symptoms and those without. So they would, being more likely to be contacts, also be more likely to be asymptomatic. Lastly, they're less likely to have an underlying condition or be hospitalized because they're younger. The most common employment sectors of COVID-19 positive individuals by race ethnicity is as follows. Amongst the Latinx, the highest number of percentage of cases now is happening in services and sales as we've opened up these sectors in the last 2 months. A close percentage of 14% in agricultural and farm work, 12% in the unemployed, 10% in healthcare, and 9% in construction and related trades. And I just want to note that most of these sectors, the agricultural, farm work, healthcare, and construction, have been open from day one in some way, with some limitations, but they've been open. In the white non-Hispanic group, the majority of cases are occurring in not working or retired persons, and followed by services and sales, healthcare, professional, managerial, and in the unemployed. Diving deeper into the agricultural and farm worker case data, we have 5,050 cases of COVID-19 that have employment information as of September 11th. 340, or close to 7%, described working in the agricultural and farm worker sector. This report dates are from March 31st through September 3rd. Of this group, as you'd expect, the majority are field workers. That's over 50%, but up to 30% did not disclose, and they're likely going to fall into the same group of field workers. 6% were in bottling, warehouse, and packaging. 4% of cases were occurring in owners, managers, supervisor positions. And then you can see very few cases occurring in these other groups. And there have been some cases occurring in vineyards and tasting rooms, not just those in the field. So we do have cases in that group as well. So we've had a total of 88 unique vineyard, wineries, and ranches that were noted as a place of work amongst these cases. 29%, however, didn't mention a place of work. There's been 12 clusters with 5 or more positive cases, with a range of 5 to 38 confirmed cases. The average number of cases in these 12 clusters is 11, and the median 7.5. So a lot of cases occurring in these clusters. About 1/3 noted the workplace as a confirmed or likely place of exposure. And again, this analysis doesn't include winery and tasting room customers who did put down winery as a place of exposure, and we've had a handful, if not of more, of these cases occurring as well. Here is the timeline for the cases occurring in agricultural settings, and as you can see, the majority were occurring in close contacts, and we had huge spikes again in early August, also late July. That was sort of where we had a more peak of cases, and then there's been a lot of cases occurring due to community transmission, very few due to travel, but still a good proportion in the unknown sector. But the good news is even these cases are coming down. Now we'll look at cases occurring in children, defined as those under age 18 by report date. As you can see, we've actually had a lot of cases occurring in kids. Many have been asymptomatic. Very few have actually been very ill, but we have had a lot of cases. And again, those cases peaked somewhere around late July to mid-August. But even in late August, we're having a lot of kids being diagnosed. And largely these are kids that are contacts to their family members and diagnosed due to contact investigation in households. But we've also had school and childcare center outbreaks. And I did present this data last week. 15 schools and childcare facilities have had known cases. There have been 3 clusters of at least 5 cases, if not more, and 1 cluster of 30+ cases that is ongoing. In total, there have been 66 cases occurring in these settings. 27 students, 10 staff, and 29 parents or siblings that have become cases due to these outbreaks or clusters. And as you can see, these facilities are located all over Sonoma County. They're not limited to one area. And we highly suspect transmission in these settings because the exposures occurred on site. And as you can see here, we've had 6 early care and learning centers that primarily had students as cases and some staff and family members. We've had 3 elementary schools, but since elementary schools have not been in session for in-person learning, these have primarily been staff or family member, a family member. And then the family child care homes, of course, have been in session for in-person learning. And there we've had students, staff, and a lot of family members. So anyways, that's kind of a breakdown of the clusters that we're seeing. And it's important to look at that because we are moving here towards the red zone. Once we get into the red tier, that is, we will be able to potentially open schools for in-person learning per the rubric from the state. So looking at the different clusters that we've had, cluster 1 occurred in early care and learning center in North County. There were 30 cases as of September 15th. 16 students, and a student was indexed, or first case, 3 staff members, 11 parents and siblings. The outbreak is ongoing, and there are at least 11 contacts that are still pending. And the facility was closed for a 2-week period in the beginning of September. Cluster 2 is a family child care home in the Central County. 9 cases, 2 occurring in students, 1 in staff, 6 in parents and siblings. And the cases are now closed and quarantine has been completed. Another family child care home in Central County with 10 cases, 3 students, 1 staff member, 6 parents or siblings. And the facility was closed for a period of time, and quarantine is now completed and the cases are closed. So in addition to these clusters that we've discussed, there's 12 other facilities that have less than 5 cases reporting possible exposure on site. And an additional 9 facilities in the elementary, middle, and high school description that have been mentioned in case investigations. And again, you can see the facilities are kind of located throughout the county. These schools are currently remote and have a total of 18 students, 2 staff, and 16 family members that are confirmed cases. And this does represent a potential for more exposures if schools were to reopen. That's kind of the take-home point here, that we looked at this data very specifically because we wanted to know what the risk was as we moved towards school reopening. So there have been 381 cases in the age 0 to 17 age category that are still under investigation by public health and epidemiology. And there may be potential for school-related cases that have not yet been identified in this group. I want to switch gears here to influenza and just report that we are preparing for flu season during the COVID-19 response. And in order to address these 2 different illnesses, we are going to be reissuing the 2019 health order that requires healthcare workers to receive a flu shot, and if they decline, to wear a mask for the duration of the flu season while working in patient care areas. This will probably be supported by the majority of counties and the state. We're also highly encouraging the public to get an influenza vaccine or flu shot through a campaign, a communication campaign. And we are going to increase accessibility by offering these flu shots on designated days through the Sinead drive-through for those people who are priority or don't have access to flu shots specifically. So now I'd like to switch to some balance measures or county health indicators. The COVID-19 shelter in place has had impacts on lots of other sectors other than just health, obviously. There's the economy, the environment, and then other forms of health, the physical health, but also mental health and well-being. So I really want to go through some of these in more detail. Our epidemiologists have really done a nice job putting together these balanced measures for us to take a look at. Looking at unemployment rates in Sonoma County, like the majority of the state and the country, we saw a big increase in unemployment after shelter in place, and that's to be expected. So here in 2020, as you can see, starting when shelter in place was put into place, we saw a big spike in unemployment that has been improving over time, but is still significantly greater than what we saw in previous years. With our fires, we've had some real issues with air quality, and we thought we would highlight the air quality because that's really affected people in the community. You can see that we were doing fairly well for the majority of our shelter in place time. That would be March, April, just a second. Okay. So we were seeing fairly good air quality March, April, May, June, and July. But then as you can see with our fires in August and September, we have had significant worsening of air quality even compared to the previous 3 years. So the yellow bars are the previous 3-year average. The green is what we're seeing this year. So that's something we need to track. Hopefully it'll improve as the smoke clears, no pun intended, and we move forward towards better air quality. We also need to look at our 911 call volume by month. And we can see that here in the green is 2019 and in the yellow is 2020. And we did see perhaps blowing that up a little bit there in March and April, especially March, a decrease in 911 calls for cardiovascular events, but it's been fairly stable. And if you take a look now in July and August, we actually have increased numbers of calls and a 911 response for cardiovascular events. Get back to this. Okay, so if you look at cause of death, January through August 2017 through 19 compared to 2020, the one thing that really stands out is the deaths from overdose, both intentional and unintentional. That's up 27%. And we've definitely been hearing from our EMT, paramedics, and firefighters about this. Deaths from unintentional injuries are down 5%, deaths from suicide down 16%, and deaths from motor vehicle collisions down 35%. It does make sense, I suppose, with shelter in place that our motor vehicle collision deaths may be down because not as many people are out and at risk. However, it is a little hard to explain some of these statistics, and we'll continue to follow them. The numbers are, there may be some effect from just having low numbers, but we'll continue to track this and report regularly on these statistics. Looking at sexually transmitted infections, Sonoma County STI cases shows a decline from 2019 compared now to 2020. However, the case numbers remain high and really are likely an underrepresentation of what's going on. CDC reports that testing for STIs plummeted during the pandemic, as many other preventative or healthcare statistics plummeted in terms of people seeking care. And the estimate, and this may be the reason why many STIs may have gone undetected as a result of not being diagnosed due to people not seeking medical care during this time. So it's something that we have to pay attention to and that we need to follow very closely. As you would expect, immunizations during the pandemic time in April plummeted compared to the previous year, 2019, because of shelter in place. But luckily, the immunizations are again increasing over time here, and they're still not where they were in 2019 in August, but we are getting there. So hopefully in children aged 4 to 6, we're going to catch up in immunizations at this time. We are still reporting that our behavioral health warm line is being used on a daily basis. Again, the warm line provides mental health counseling from a professional in both English and Spanish. And when we do advertise the warm line, we have more calls, and it has been used pretty regularly here since its inception in the end of April. Again, the top reasons for calls are anxiety, resource needs, loneliness, other, and feeling overwhelmed. Now that we are providing a lot of services for children again, we are equaling up, I think, our child maltreatment allegations that often are made outside of the household in child care settings. Initially, we had seen quite a decrease in these allegations being reported, but now we're seeing that that's catching up and is about where it was last year at this time.